Guess one thing I've wondered about this, and it's interesting hearing you talk about addictions there for that example, because I think that's a good example to use. To what degree in therapy do we address the behaviour that someone is having an issue with, or do we address the motivating factors behind that behaviour? Because if we take an addiction, for example, it's the behaviour of partaking in substance abuse that is the addiction itself, but potentially there's some motivating factors behind that which are causing the person enough distress to find themselves in an addictive state in the first place. So when someone comes to see a psychologist, are you looking to address the, I suppose, underlying problems that are leading to distress and maybe manifesting itself in a range of ways? Or are you looking more to address the behaviours in terms of whether it be anger or whether it be that someone's behaving antisocially? Are you looking to stop them behaving antisocially, or are you looking to stop them having the motivation to behave in that way?
Yes, well, again, a good question. It's going to depend partly also on what a client requests when they first come in, what the emphasis on it might be. But just say if someone is looking to reduce their use of alcohol, for example, I think in the first instance, we're going to consider motivation in terms of the person's readiness to change. So at first, we're going to look at their reasons for looking to reduce their alcohol and also reasons why they might want to continue with it. So we don't ignore that side. So we might have some exploration of that. But soon enough, like certainly what my tendency would be and many psychologists' tendency would be to start off somewhere with what kind of change the person is ready to make. Because the person might already have done some things to look to cut down their use of alcohol, or they might have thought of being about to do something to cut down the use of alcohol. And I think in the first instance, you might start off there looking to change the behaviour more directly. Like they're coming along to see a mental health professional, they're a little bit motivated to at least that extent. And so at first it might be looking to invite the person to look to reduce their alcohol use to a certain amount. Now, what will typically happen as the person looks to put that into practice is they'll come across certain obstacles, if you like, to cutting back. And that will make clear, or a little bit more clear, what some of the underlying motivations might be. Like, for example, the person might try to cut back and they might find that they're feeling stressed when they're cutting back and they're not using that usual way. They might have used alcohol, as many people do, as a form of self-medication. About 8 out of 10 people who abuse alcohol are using it like self-medication to deal with anxiety or stress. And so then it might become clear that the person needs to develop other stress management techniques in order to make further progress. So we could start off, in a sense, assuming that the person just needs that stress management strategy, and it might be worthwhile including anyway. But I think often how therapy proceeds is it's a little bit of both. You start looking at changing a behaviour that the person says that they want to change or go in a different direction, and then you find the obstacles to that, and then you find that there are other motivations behind that, and gradually you can kind of peel back some of the layers, if you like, of what might be influencing people's behaviour. Like they might have underlying unresolved grief or depression that might have been holding them back. The person might have avoidant tendencies that we've talked about before that lead them to be really fearful of maybe asserting themselves in certain situations. And so that's leading to their anger and stress being more pent up. It tends to be that as you look to make shifts in behaviours more directly, it helps bring up some of the underlying patterns. But I think that many therapists like myself will also be exploring some of those potential background patterns or motivations or influences in the early sessions of assessment. So you look at a bit of both.